Good evening, how are you? I'm very well, thank you. Okay, so before we start the test, I just need to go through a few quick questions with you, if that's okay. Alright, it won't take long, I promise. Our computer system's down at the minute, so I'm going to have to stick to the old pen and paper. I say pen, I haven't even got a pen, I don't think. Have I? Oh, actually, I've got one here. Got one. Alright, so if I can first ask you your name. Okay. So, we've got the right patient. And your date of birth. And the full line of your address and postcode, please. Okay. I wrote that down wrong. So number 12. Alright, Anna's 21. Silly me. Anyway, alright, so we've got all your information correct now. And I can see that it has been a year since you were here for your last cranial nerve test. So you're in and around at the right time for another checkup. It is good to get our regular cranial nerves checked. Yes. Have you noticed any headaches or eye strain or any sensitivity to light at all since you were last here? I know last time you were here, I think you had a slight migraine, and that's why you came to us in the first place. You haven't. You've been quite well this time around. Oh, good. So did you just want to return to us for routine? You're just going to keep up with it? Yeah, it's really sensible, to be fair. There's no... And you said you haven't had any sort of sensitivity to lights or anything like that since last time. That's good to hear. I know I've got on my notes here that you were quite iffy with lights the last time you were here. Very sensitive. Okay. So I'm just going to start by doing a little checkup of your all-round general health at the minute. I'm going to check your blood pressure and just have a check of your heart and your breathing, all the general stuff first. Okay. So I'm just going to put some gloves on and check that out, okay? So, just get my gloves out. Might pop these down here. I haven't been too bad, thank you. Yeah, I remember you from last time, yes. Yeah, I do remember you were quite sensitive to lights when I did the light test on you. You were quite fascinating, really. You really responded well to them, actually. Let's see if you get the same results this time. Right, I'm going to take this off and put my apron on, and then we'll get right into it, okay? Alright. Pop this on. It's not necessarily for protection or anything, it's just routine. I have had it in the past where I've needed to wear an apron, so I just wear it as a precaution. Some people are very poorly when they come to me, and I won't share the details that why I put this on, but I've needed it. So this is why I put gloves and apron on when I do the test. Yeah, people get nervous, but there's no need to be nervous, I promise you. Alright, so I'm going to listen to your heart first, alright? So pop these in, and it's just going to be a little bit cold. So if you're ready. Okay. Okay, and I'm just going to listen to your heart first. Okay, that sounds good. And I'm just going to go to your back, and if you could breathe in nice and deeply for me. Okay, breathe in. And out. Very good. Breathe in. And out. Thank you. Alright, and again at the front, just right in the center of your chest. Breathe in. And out for me. And again, breathe in, hold it, and out. Okay, that sounds all good to me. Yes, it sounds very good to me actually. Really nice and clear. No abnormal heartbeats or anything going on in there, so that's good. Alright, and next I'm just going to check your blood pressure. Alright, so if you'd just like to hand me your arm. Alright. And pop that down there like that for a second. And could you pop your arm in here? And that's it, just like that. And I'm just going to tighten that up for you. Alright, okay, good. And keep nice and still for me. And do not talk while I do this, okay? Nice and still. Takes a little while. It's a bit old. Okay. I'll just try that again because it didn't quite read your blood pressure for some reason. Again, keep still. Try one more time. Okay. It's hard to keep still for so long, but it's fine. I think my machine might be broken. Let me do this the manual way, okay? 2 seconds and I will be back, alright? Right. I'll just add a different end onto this. I'll put that back in your arm. Okay. I'm just gonna just listen to that. Okay. Okay, that sounds good. Let's take that off you. I'm just going to pop my things there and take this off you. Alright, that's that done. And that's that done. Alright, okay. That sounds all good. Yeah, our technical side is not working very well today. Our computers are down. My blood pressure machine's just broke, so we're off to a good start, but never mind. It just means I'm going to have to be a little longer with you, but I hope you don't mind. Alright, so let me just write your blood pressure down. It wasn't last time you were here. Okay, so okay. Alright. So I'm next going to just check up your nose and in your throat. This is the most probably unpleasant part of the test, but it needs must, so I'm sorry. I'll apologise now. But if you've been nice and still for me, I will be as quick as I can and we'll get you sorted with this part fast. Okay, right. So this bit here is just to look up your nose. I've just got a little attachment I put on my light. If I can get it on. Can't seem to get it on. That's it. Alright. And this has a little thin light that goes up your nose so that I can have a good look. Let's have a look. Okay, ready? Okay. Sorry, I have to get really close to you right now. Just really close. Okay, that's that nostril. Let me see the other side. Okay. Okay. It looks all good up there. Alright. Looks nice and clear. No lacerations or anything in there. Nice and fresh. Alright. And then I just need to look in your throat, unfortunately, which a lot of people do not like. But again, needs must. Just need to find my bit to go on here. That's it. Let me just pop that on there. Okay, so I just need to pop this on here like that, and then I just put this on the end of there, and this will go into your mouth. So open wide, stick your tongue right out, and we'll just go right in there. Okay. Say stick your tongue right out for me. Okay. Very good. Alright. I can't see anything in there that looks abnormal either. Just give that a quick wipe down. Where are my wipes? Where are my wipes? Okay. Right, that's that. Alright, so you're all good in the nose and the throat so far. So that is good news, and that's the worst of it over now, so you'll be happy to know that. Alright, so the nose and the throat is clear. Just jot that down before you forget. So nose and throat. You haven't got any sore throat going on at the minute, or that you've been experiencing lately? No symptoms of any sorts in these areas? Right, that's okay. We just have to check these things on our cranial nerve. Yeah. Alright, so next we'll do, we want to get all the quick bits out of the way first, and then we'll get to the more complex bits where I have to take more time on things. Okay, so I am going to do your sharp or soft touched objects now, and you know how this works, you've done it before, remember last time? Yep. So I have in this bag here, I have a blunt object and a soft object, and I want you to close your eyes. Close your eyes, thank you. And I want you to tell me whether the object I am touching you with is soft or blunt. Okay. Good. Okay. Good. Yep. Good. Alright, and one more. Alright, very good. You did it like a pro. Well done. I don't want to prod you too much and irritate your skin. Okay, so you identified them all well and correct. There is nothing wrong with your sense of touch. Okay. Right. Now I'm going to do your smell test, and again I'm doing these quite quickly. We don't need to do too many today, as I know from last time there was nothing really wrong with your sense of smell, so I am going to get 2 distinctive smells, and if you get them right then I think you're good. Alright, so we'll start with this bowl here. I have a scent that is in here. And if you just like to smell it. Good, you got it. Well done. Yeah, it's very strong, yeah. It's lovely. It makes you feel awake. And this one here. Just drip the drips off. Smell that one. That is rose. Well done. Yeah. Very well. You got them straight away as well, so nice and quick and easy for you. Alright. Okay, so last time you were here, you didn't do these tests, so I'm going to do 2 new tests with you today. Alright, so I've got a taste test, but they are slightly different. I have them in little strips here, where I'm going to just pop them on your tongue, and I've got 4 different tastes that you should be able to identify. You don't have to necessarily say that it's a certain thing, but you can tell me whether it's sweet, bitter, salty. You get what I mean? And then one might be a certain taste, but I have that. Okay, so just tell me what this taste is. Yep, that's salty. This one, sweet, very good. This one, chocolate. Yep, that's the one. And then obviously this one is bitter. Yeah, very good. Well done. Alright, so your taste buds are working perfectly. our taste buds work in certain ways where they distinguish salty, bitter and sweet sort of tastes, so we've narrowed that down to that. So it's been proven very successful at the minute with our testing system, so we're keeping that going. Alright, so the next one that's new is a test where I'm going to blindfold you, and I am going to put a fan near your face, really close, but you've got to tell me when it's close to your face and when it's far away. Alright, so I'm just going to blindfold you. Okay. Alright. Alright, there we go. Can you see anything? Good. That's what I like to hear. Alright, so let's see. I'm going to come up to you with this fan. I'm just going to plug it in now. So you can hear that now. Can you tell me if it's close or far away? Close or far away? Close or far away? Good. Left or right? Left or right? Okay. Close or far away? Close or far away? Well done. Brilliant. Okay. That is very well done to you again. Let me just take off your blindfold. Okay, that's that. That is you done there. How did you find that one? Easy? Okay, good. That's what I like to hear. Alright, so the fun test all cleared. Alright, so I'm going to get into the more in-depth testing soon, but I just want you to do a few quick facial expressions for me. Just very quickly. I mean, I've tested all your movements out last time you were here, and you were perfect, and if you haven't had any more symptoms since then, I will just leave that out today. You haven't had any other symptoms, have you? No? Okay, good. So I'll leave that out. I'm going to test your facial expressions though, so if you could just frown for me. And smile. And closed mouth smile. And grit your teeth. Stick your tongue out. Okay. Puff your cheeks out. Okay. And again. Alright, and now I'm going to push your cheeks while you do that. So puff your cheeks out. And try and stop me from doing that. Okay, good. Alright, so I'm going to put my hand under your chin, and you've got to try and stop me from pushing it shut. Okay? So open your mouth and just try and stop me from pushing that shut. Alright, very good. Alright. Your facial muscles are still working as well as they were the last time you were here, so well done. Alright, so one last thing before we get into the hearing and eye test, and then we're all done. I just need to look at your skin quite closely, so I'm going to get my light, and I've got a magnifying glass here. You can close your eyes if you like, or you can keep them open, but I am going to be extremely close to you, so just be warned. So don't mind me. I'm literally going to just look at your skin for a little while. Mm-hmm. Alright. That's it. It's good. Nice and clear. Yeah, you've got really good pores actually. Better than I've ever seen. Very good. Alright, so all the skin's looking good. There's not abnormal spots or moles on there. I see you've got a slight bit of tan, but that's expected with this weather that we've been having, so there's nothing abnormal on there. Alright, so we'll do the hearing test first, and then we will move on to your eyes, okay? Alright, so firstly, I'm going to use pitching forks, and I have 3 different pitching forks here. These ones here, and I'm just going to start with the smallest and work my way up, and I just want you to tell me when you can no longer hear it. Okay. Yeah. And this side. Good. Alright. And the next size up. Good. Okay. And the next one. This is a nice one. I like this one. Okay. You can hear it. Okay, good. And again. Okay. Good. Alright, well done. Well done, well done. That's that part out of the way. So, I've ripped my gloves doing that, oh dear me. Okay. Let me just take this off for now. Actually, this one is okay. I'll just get a new one. I needn't waste 2. Let me just get one more and replace that one. Put a hole right in it. Put that one in the bin. It's very hot today, so my hands are quite sticky. Alright, so now I'm just going to use something here to whisper into your ear on either side, and I want you to tell me what I'm whispering, okay? Good. Good. Can you tell me that one? Okay, good. And this side, I'm going to just whisper. Okay. Okay. And one more. Okay, good. Well done. Alright. That was very well done to you. Okay, so I'm just going to get my otoscope and I'm just going to look in your ears now. Check that there's no blockages in there. Okay, just looking in there. Don't see anything. I'm just gonna look a little bit deeper. Alright. Okay, good. And on this side. Okay. Very good. Alright. Okay. Nothing of any concern in there either. Alright, so there's nothing worrying in there. You've still got your ear canals and everything is intact. You've got no build up in there, so that's good. Have you had your ears cleaned recently? You have? Okay, I thought so. They're extra clean. Yeah, alright. Well, keep them clean. It keeps them nice and clear. Alright. Okay, so it's time to look at them eyes of yours. We've got most tests on your eyes and then we're all done. Yes, it is extremely hot today and you're my last patient, so I can't wait to get home and chill out and relax. Yes. Let me just jot a few notes down. The whispering test was fine. The pitch and foc's fine. That's good, fine. Okay, so the sight test now. So we have a few little things to do on your sight test, alright? So let's start with... Shall we start with a colour test? Yep. I'm just going to dim the lights down for your eye test because I need them a little bit lower. Can you tell me what colour this is here in this eye? This side. Very good. And I've got another coloured lens in here. Could you tell me what colour this is? Very good. And on this side. Okay, brilliant, brilliant. Colour is fine. Alright, just put them away. One more part of your colour test is we can do that. Okay, let me just put this light here. Alright, so we got can you tell me what this number is? Yep, this one. Good. This one. Okay, and this one. Alright, and do you see them completely clear? Good. Alright, that's good, 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 good. Alright, so there is no issues with your sight in colour wise, so there's no colour blindness in there at all. Alright, and now I'm just going to get you to look at my chart. Alright, so can you tell me what this letter is? And this one. Good. And this one. Good. And can you tell me what this one is? And this one. Oh wow, well done. And what colour is this here? And this one. Good. Alright, well done. And one more here. Very well done. Very, very well done. I actually think your eyes are better than last time you came here for some strange reason. Are you sure you haven't got contact lenses in right now? Okay. Alright, let's see then. I want to cover your eye up and I want you to tell me how many fingers I am holding up. So how many? Yep. Yep. Good. Yep. Good. And on this side. Very good. Okay. Very good. All right. Brilliant. Thank you. All right. And then I'm just going to get you to follow my light. Okay, so here we go. So look at my light and follow it. Alright, follow my light. Good. And again, follow my light. Let's just turn this light off here. Put that out of the way. Follow my light. Good. Okay. Alright, and then look at my nose. Keep looking at my nose. Alright. Okay. Here. Okay, good. And up. Down. Okay. Okay, very good. And again. Very good. Get close to your eye just to see how your pupils react. Okay. Now I'm just going to look even closer. I promise this is the last time I'm going to get close to you, so don't worry about that. And then we are all done. Okay, so this is a bit bright, but don't worry about it, okay? Okay. Okay, just try not to blink. Keep try not to blink. Just look above. Okay. And the other eye. Okay, so that's good. Alright, just keep still. Alright. Alright. We'll tap on this side just to check. That's good. Alright. So I actually think we are all done, and I think you did even better than the last time, which makes sense because you did say that you had no issues this time round. Let me just turn my light back up for you. Alright, so everything seems to be absolutely perfect with you. I actually recommend that you come back in another maybe 2 year, maybe, we'll see. If any changes happen, though, please do come back earlier, make an appointment with us. But as far as it goes, you're probably the healthiest patient I have actually seen today, so well done to you. Yes, you keep looking after yourself and doing what you're doing, and I will see you hopefully in 2 years. But if you do need to come back, then you know where we are. Alright? Okay, well, I know it's a bit late, so you go home and have sweet dreams, okay?